Hi, can everyone see the screen now?
Yes, Manish, we can see the screen and your photo. Everything good. You can start now.
Okay, great. So good afternoon, everyone. I'm Dr. Manish, and I'll be presenting a very interesting topic today. It's about conflict resolution in healthcare setting. I'm Dr. Manish, and I'm from Hazem Mubarak, a specialist in internal medicine. Before we begin, there is a pre-presentation survey. You can go on the link and give your feedback. It is required for the accreditation process and CME activity registration. Thank you. I would like to declare that there is no financial or other competing conflicts of interest which I have to declare regarding this presentation. I'm affiliated to these institutions, and all of them promote unbiased education activities with no financial interests. So what are we going to learn today? There are a few things about conflict. What are the causes of conflict? What is the difference between a conflict and disagreement? Are they the same, or is there any overlap between them? What are the advantages and disadvantages? Can conflict be advantageous to us, or is always leads to fight and disruptions? Types of conflict. Reducing the risk. How can we reduce the risk of conflict in our workplace? What are the goals of its resolution? And what is the process? How do we resolve a conflict? What is the conflict resolution process? There are processes, many processes, which I'll explain to you later. And communication models for conflict resolution. And when it is time to give up and ask for help. So as always, I'll start with a small synopsis video for all of you to share. And okay, so it's gone again. Somebody logged in. The screen has gone blank again. Sorry.
What is it about conflict that makes it so difficult to deal with, and how come good people can turn into such monsters in the face of conflict? The most common way of dealing with conflict is to avoid it. Some people walk away, others get really upset, wind themselves up and attack, and others just get sick or go on stress leave. In fact, it's amazing what people will do in order to avoid conflict and the emotional stress that comes with it. There is a very clever saying that goes like this: denial is not a river in Egypt. Denial is, however, one of the most common problems when it comes to resolving conflict. When confronted with a tense or difficult conflict, too many people smooth it over, bury their head in the sand, and the conflict goes on for another 1, 2, or 3 weeks, months, or even years in some cases. I want to introduce you to a definition of conflict and then give you a pathway for the resolution of conflict. Before I do, I want to say this. For some people, even the word conflict means warfare, dead bodies and blood on the streets, and it's very common for women and men to see anything less than that as not being in conflict at all. So this is a definition that starts at a very low level, because most conflict starts out as very small upsets and builds and grows into a full-scale battle. So here's the definition. Conflict exists when one person has a need of another and that need is not being met. Now, don't be fooled by the simplicity of this definition. The resolution of conflict starts from here, and the first step is to express the need. The second step is to find out if the need can or cannot be met. If the need can be met, then we have resolution. If it's a no, then we negotiate to resolve the conflict, or we go into the management of conflict. So here's the problem. Most people go straight from having an unmet need into the management of conflict, bypassing step 1 and step 2 because they are afraid and don't talk to the people who can do something about it. And that's not pretty. In fact, it gets quite ugly. So here's what the management of conflict looks like. Sulking, withdrawing, getting sick, the silent treatment, backstabbing, gossiping, shouting, blocking, being aggressive, and getting angry. So the resolution of conflict starts with expressing your unmet need and then finding out if your unmet need can or cannot be met. If your conflict has escalated to the stage where it's too tough or sensitive or difficult to handle, then you really need to think seriously about involving a neutral third party to help you mediate the dispute, and we can help you out.
So this was the synopsis, and we'll start with this. What is conflict? Conflict is defined as an interactive process manifested by incompatibility or disagreement between two parties. It could be individual, it could be group, organization, towards an unmet need, anything.
Sorry, Dr. Manish, can you open your camera?
It has to be an unmet need, an interaction between two people or two individuals to go ahead, and that is where the difference, which I'll explain later, between disagreement and conflict would actually be. In conflict, there is a disagreement of friction. When we have different beliefs or we perform different actions, which frustrate the other action or counter-action, there is a perception of mutual interference. You know, if I think of something in patient care and somebody else thinks about a different plan, we need to agree on it to go ahead. Otherwise, we have a conflict. So here we share the same common pathway. That is the reason why we have a conflict. It can't be, you know, if George Bush or Trump disagrees with some foreign policy, I might disagree with his policy, but I share the same common goal, so there can be disagreement. If you want to buy a Range Rover, I want to buy a Mazda, we can disagree, we can continue to disagree on, but there is no conflict. But here there is a mutual interference, a process which begins with the goal of one party are frustrated by another. We have a common goal. In our healthcare setting, it is patient care. So when the patient care is involved with two different management teams or two different plans, there has to be a conflict. It's a dynamic environment.
Dr. Manish,
Yes.
can you hear me? Yeah, I think there is another PC near you. Open his mic because it's coming. The sound not clear, and your photo not coming. I think if you open your mobile and the PC, this is the problem. Or near you, now it's good.
Now it's good?
Yeah, now your voice is good.
Okay, good. Yeah, so Dr. Naseem was here logging in on the side. Okay, no problem. So we'll continue. So see, the conflict has to be between two people where they share the same goal and when there is an unmet need. What is the difference between conflict and disagreement? As I just told you, disagreements are open. They are arguments. They might have a disagreement between each other. They might agree to differ and carry on. You can do whatever, I can do whatever, and we don't cross each other's path. There can be disagreement in what we do, but then it doesn't hamper anybody. We don't have to sit down to resolve it. What is conflict? Conflict here is when you have a strong feeling of an unmet need that somebody else is going to do will hamper your work. So it's a closed setting. You know, there is a desire which is completely shut down. you feel frustrated, you feel stressed by other people's action. So this leads to a misunderstanding between the two parties involved. It can be resolved, however, once we sit down and discuss the misunderstanding. The key to resolving conflict, therefore, is identifying what is the perceived threat and what are the strategies to solve them. Here we have to remember that it is not always bad to have a conflict at workplace. I'll tell you the advantages of it soon. So now what we've seen is that the conflict occurs with an overlap of 4 different processes or elements. It has to include opposing interest. My action will result directly in opposite to what you are doing. So it leads to a zero-sum situation. What zero-sum situation is when one person's gain is another person's loss. So the net sum is 0. And something, the process or the patient care or the workflow, it's hampered. Second element here is that it's belief. It involves strong belief. I believe I'm right, you believe you're right, and both of us can't be right. So we have to find a process to resolve it, to find a common ground. There, the third element comes in, the process. It develops out of the relationships and context in what we are supposed to do. And then finally, the fourth element being action, when one action doesn't thwart another goals. So we both work in tandem. So these elements are there in a conflict, and these are to be addressed by sitting down to resolve it. And how do we do it? We'll see in the next slides. As I told you, there could be advantages of conflict. It's not always bad. It opens our eyes to new ideas. You might be thinking something, but then when there is a conflict, you have to sit down and take others' opinion and see, okay, why does he think that? Okay, he may be right, you may be wrong. So it gives you new ideas. It gives you opportunity to verbalize the needs. You need to see why patients or why a workflow process has been hampered, or why does it need to be done, why things need to be done. You need to verbalize it, you need to stress, so you gain confidence in what you want to do. So conflict is good in this way. It teaches you to be flexible, to listen to others. It makes you an open person. It teaches you what is the pattern of behavior in a certain situation, in a workplace, in a hospital setting. How do patients react to when you suggest them chemotherapy, or how do patients react? What is their reaction? What is the family's behavior when you want to treat or do a very invasive procedure in an 85-year-old gentleman? So there is a pattern. There might be conflict, but then you'll see a pattern of behavior in the society, and you will change your attitude and modalities of treatment and management based on the pattern. So it ultimately leads to solutions which are both good for both the parties. So conflict has helped you to find a solution which is agreeable to everybody. Then it also helps you practice your communication skills, which is part of the ComSkill mandatory course program in our corporate policy. Everybody has to attend communication skills. I hope everybody of you have attended it, or maybe will attend it soon. It helps you practice your skills when you sit down and negotiate and assert and affirm or avoid, or what strategy you use. It helps you communicate. And it also helps us to set limits, practice our emotional control. We may get upset. Somebody is not listening to us. I want to do this particular thing, and the other person is opposing me. So obviously I'm upset. It takes an emotional toll, but then you learn. It is an advantage in the form that you learn to be develop emotional control, be strong in your actions, and it helps us to differentiate between different people and how you deal with work. Of course, the biggest disadvantage of conflict is that it is very, very heavy on the toll, on the emotions. You stress out, you get sick, and you may feel left out, you may feel that you're not valuable enough to the company or the patient doesn't see you in the same light. You want to do the best for your patient, but then he's always arguing about your methods of management or methods of treatment or how you're taking care. You may feel neglected, or maybe if it's a colleague, you may feel bullied that why my senior or my consultant or my management or is always disagreeing to what I propose or what do I do. You may feel sick and bullied and harassed, and you may think of it as favoritism. So conflict is negative. These are the disadvantages, It ultimately hampers in a hospital setting continuity of care simply, and the patient safety is hampered. So now that we know about what conflict is, what are the common grounds? Is it beneficial? What are the advantages? What are the disadvantages? We'll come to what are the types of conflict. So what types of conflict can actually happen? So we can divide it on two sets basically. One is individualistic, meaning intrapersonal conflict within an individual, what's going on inside you, what you want to do versus what you should do or what you've been asked to do. There could be a conflict within your person. Second is interpersonal conflict. It could be between individuals, between two team members. One wants to do surgery, the other wants to do a conservative management, and then there could be a conflict. Third is intergroup conflict. Intergroup conflict here is, I would say, two different groups. Let's say in a healthcare setting, a team of doctors versus team of interns or residents or nursing staff. There are two different groups. Their thinking process is different, and they would like to argue that their point is much better in ultimately leading to patient's care. Or it could be between two groups of people in the sense the doctors versus patients and patient's family. So patient's family might want something, and the doctors or the team or the healthcare providers as a whole would want something else. So this is where the conflict arises. And the last is inter-organizational conflict. It is way beyond our domain. It could be between organizations, different organizations providing same sort of process. See, again, the disagreement can be always there between organizations, but then conflict will arise when they share the same goal. Let's say, for example, private healthcare providers in Qatar or government versus government sector, PHCC. We have the same goal, providing the quality care to patients, but then their priorities might be different. Their methodologies might be different. Their service criteria, their employment criteria, their education, their research, everything might not be a priority, for example, for, let's say, private sector. So there can be conflict as to how things are processed. Maybe a particular, I would just give you an example. It's nothing to pinpoint to. A set of surgery, maybe there are more number of cesarean sections in private care. Maybe there is more number of versus normal deliveries in the government sector. So, there's a conflict of ideas when person sitting on top who's managing everything. There's a difference between disagreements and conflict between patient care and the methodology being provided. So these are four different types of conflict in healthcare setting. You can also divide them into task-related content, how the task is performed, emotional or relationship conflict in a private versus public health sector, or in the sector itself, how do you dislike or you have negative emotions or interpersonal feelings. And there could be administrative or a process conflict. You don't agree what the management plans to do, how it wants to set up different care services or practices. So you can divide these conflicts into two categories, on an individual basis or a task-related basis. So now coming to the sources of conflict. What are the sources of conflict in a healthcare setting? The capacity, resource capacity. You must have seen, you have only a limited number of private rooms. Everybody who comes to you wants a private room. or let's say in any healthcare setting on an air-conditioned room with television and that sort of a care. He doesn't like the food. He wants to have. So the resources are always scarce, and they have to be divided equally. You might want to put somebody in ICU who's more sick, but there is another patient who feels that no, he wants to be treated in ICU in a better setup or facility when he doesn't need it. So resource scarcity, incompatible goals, unreasonable expectations and demands of patients. That is a major reason of conflict. When a person wants top of the line, everything, we provide top of the line. But then the outcomes, they have unreasonable expectations. When the doctor will do this surgery, I will be completely okay. No, it doesn't happen. Medical science is not 100%. There are errors. There are reasonable outcomes. What we say, certain complications, inherent procedure-wise, anesthesia-wise, surgical-wise, medication-wise, you can have. Every medicine has a side effect. It can lead to potential anaphylactic reaction, right? But so this has to be explained to the patient or the person who is seeking your care, so that he has a realistic goal. Okay, only 80% of the people survive after this operation. Okay, fine. It has to be communicated. Structural factors, how the hospital structure or size or the specializations have been structured. It's a hospital thing, management things, more management people deal into it. That can be a source of conflict for the organization. Conflicting personalities, perceptions, ideas, or beliefs. So what can lead to different perception can also lead to conflict. My idea, my belief, how I want to treat an 85-year-old gentleman on a dialysis with multiple comorbidities, how do you want to proceed with that? How the family wants to see, should I want to put a patient on a ventilator, or he wants to be, when he's accepted the ultimate truth and he wants to pass off peacefully. These are potential sources of conflict in a healthcare setting. Perceived poor level of care, whatever you might do, but people might have a different idea. They might say, no, this is not what I expect, and I want good quality of care. So their quality is a very subjective term. They have a conflict on what is their perception. People are anxious in workplace setting. When people are sick, they are vulnerable. They will do whatever the doctor is saying to do. But then later on, they might have a problem. They might have an anxiety about it, how to go through the procedure. That could lead to conflict. Differences between people. Inherent differences. My thought process is different from somebody else, and it doesn't mean that somebody else is right and I'm wrong. I may be right or he might be right, vice versa. But then these are the conflict points. Cultural differences, delayed, lack of communication, which is the most important part in health communication. Communication. You communicate to the other party, and the less the risk of conflict will be there. So these are the sources of conflict. Now coming to the goal of conflict resolution. It's a dynamic environment. Healthcare is a dynamic environment. You see a lot of patients every day, and there is a different scenario for every patient, every person. And then there's bound to be conflict. So what is the goal of conflict resolution? What do you want to do actually to resolve this? We want to confront the problems, communicate openly and respectfully with someone of the opposing opinion to provide optimal patient care. That is what we want to do. That is what we are here for. So why do we need to address it? Because it is a dynamic environment. People are different every day, and it will help lead us to a solution. How do you clarify the problem? State the problem, the communication skills. How do you propose the solutions? How do you decide what the best solution is? By agreeing, by openly communicating, and then planning the solution. How are you going to proceed with it? And then evaluating the plan. Okay, we will do this, and then this might happen. This is the prognosis. There's 80% prognosis. There's 90% prognosis. You might get better. If no, these can be the complications. These are the goals of conflict resolution. We need to sit down and communicate openly and address the problem peacefully to have good patient care. So before we go to the strategies of conflict resolution, I would like to emphasize on certain terms which I'll be using later on. And it's very important to understand these terms. What I'll be using assertion very much. Assertion. Oxford Dictionary says it's an act of stating, using, or claiming something very strongly. But then it has to be understood. Assertion is being organized in your thought and communication. When you're technically competent, you can assert your point very well to the patient, scientifically, socially, and medically. You want to do your best. It may not be 100% best result oriented, but then the process of care is the best. And assertion is definitely not being aggressive, because as the dictionary states, something very strongly. No, strongly in your competency, in your organization of thoughts, perceptions, in your belief, but not as aggressive, hostile, ambiguous, demeaning, condescending. It lies somewhere between passive and aggressive. You see, passive means I let you have the power over me. I am very docile. Okay, whatever you say is right. That is being passive, submissive. Aggressive, on the other hand, sees I seek power over you, and you're aggressive, and you are asserting, you're aggressive. No, assertive is somewhere in between passive and aggressive. It says I demand respect, and I will provide you the same respect. So we both are on equal footing, and we will assert each other. You say your points, I will say my point. We'll negotiate, and we'll proceed ahead with the patient plan. This is very important, assertion, to understand this. There is a model based on assertion model, how to assert in the interest of patient safety. You need to get the patient's or the person's attention, express the concern, state your problem, propose the action, and then reach a decision by saying, okay, this is what we both agree on. And then ultimately, again, get back the patient's attention. So this is a circular thing. And then we proceed on to the next step or the next model or the next process. That's how assertion model works. And how do we apply an assertion model in our setting? Okay, there are a few hints. We choose a topic. We don't choose who's right or who's wrong. It is about what is right and not who is right. We start with quality of care. We discuss about a common goal. What does the patient want, or the patient's family want, or the colleague wants, or your subordinates want, or the management, anybody. We start with quality of care, the welfare and the patient's safety. It is hard to disagree. Nobody can disagree to that. So you have a common ground to build with, to start with. Always avoid the issue of who's right and who's wrong. Concentrate on doing the right thing, the right patient care. Depersonalize the conversation. Don't say, I think so, do things. No, the best interest of the patient, we should do this. The best interest of patient, we can go ahead with this. So depersonalize. It's not about me and you, it's about the patient. So the question of me and you or who's right or wrong is gone. Actively avoid being perceived as judgmental. Don't judge anybody's belief. He has a belief. The patient's family has a belief. You are not there to change their belief. You are there to help them provide comfort in their vulnerable stage. They are here to ask you for your help. You are here to provide them in what they believe is comfortable and what you think is the best for the patient. You have to be hard on the problem, not on the people. People have different views. Conflict doesn't need to be there. It's about patient. So how do you go about it? You analyze the conflict. When possible, always prepare yourself to be ready for a conflict. Seek a common ground. Build understanding with the patient. Build a rapport with the patient. When you have a rapport with you have a common goal. When your personal equation is gone, when it's all about patient, you want to build understanding. Then on that understanding, you create solutions. If there are multiple issues, go one by one. Okay, for this, we can do this. We cannot put you in ICU. We can put the patient in high dependency unit, which is equally good. And maybe patient will agree to that. So, okay, we cannot provide you with a single room, but we'll not put you in a ward. We can put you in a room where you have 2 or 3 other patients. So there's always a solution. And then define the details. Whatever you've said, you need to say, okay, we clarified this, we've agreed both on this, and we'll proceed with this. So then define the details. There is no reason to be disagreeing with the patient or you. There's no error in communication. Now coming to the strategies. This was very important, you see, how all these things are correlated. It is very interesting to understand. We have a strategy how to go about resolving a conflict. You can see in these quadrants, there are 5 basic methods which have been described, accommodating. So here you're neither being cooperative with the patient or neither you are doing anything. You're just accommodating. Okay. Just fine. I'm fine with it. Whatever you will say. I want to maintain relationship with you. You are a very nice person. It's okay. You say I agree to it. You're accommodated. But then as a doctor that this might not be in the interest of best patient care. So this is not good. Right? It is. And I will tell you later on when. Avoiding. So you avoid completely. There is a lose-lose situation. The patient is not happy because you have not addressed the problem and you've avoided completely, and you are unhappy because you were not able to provide the best treatment possible to the patient or the quality of care. It's a lose-lose situation. Both parties lose. Competing. Here, you force an outcome regardless of whatever. This is right for the patient. He needs a surgery. I will do a surgery, and that's it. So here you being assertive, but not cooperative. You're uncooperative here. You might do what is right for the patient. So you win, but the patients lose, meaning he's not going to come back to you anytime later. He'll have grudges. If something goes wrong, God forbid, there'll be problems because they never agreed to it. So there'll be a conflict which was not resolved. This is a competing view. Third is compromising. So, sorry, fourth. Fourth is compromising. Compromising is when you're concerned both about the outcome and relationship. So it's 50-50. Okay, you're a nice person. I know this is the best thing, but you don't want this. So we will go 50-50. We will not perform the 2 operations at one go. We will do one and then maybe one we can think of later on. But that is not in the best interest of the patient. So nobody loses, nobody wins. It's a compromising formula. The final, and which I personally like, is collaborating. You collaborate with the patient. It's also called confrontation, where, as I told you before, the word assertion comes. You are scientifically correct. You believe the best interest of the patient lies in a particular procedure. So you go ahead with that. And here, how you collaborate. You confront the patient. You take the problem head on. It is a win-win for both the patient, because when you collaborate, the patient's relatives or the families or patient himself, they will agree to it finally. They will come. You will tell them the benefits. You will sit down. You will understand them. They will understand you, and you will reach a solution. So this is a win-win patient situation or any process to resolve a conflict. So if you want to break down individually, avoiding, compromising, as I told you, they can be beneficial at some times, but they have their own disadvantages. I'm not going to go in detail of all this, As I told you already about what I personally prefer and what is the best thing, it is collaborating with the patient to sit down and seek a long-term solution in a positive environment. You sustain your relationships and you do best for your patient or patient care. But it has its downsides, you see. It's very easy to avoid. The patient family wants to talk to you, but you say, okay, I'm busy, I don't want to come, and it's finished. And then you tell the nurse, no, go ahead, send the patient to OT. This is avoiding, right? But in collaborating or in confrontation view, it is time consuming. You need to go sit down with the patient, you need to talk, but then it has its benefits. It's a long term. The patient will always remember you, what good you've done for him. You've made them understand. It can lead to frustration if it is used in a situation where prompt decision is. Your patient is going to die, but the patient's family or the patient is not agreeing to do the procedure. You cannot do it against his will. They need to get consent. So you have to sit down and tell them. So that is a conflict resolution process called collaborating strategy. You confront, you sit down, then you handle the conflict. Confrontation or collaboration, as I told you, is an assertive means of conflict resolution. It is a respectful negotiation. You exchange ideas, you tell them what is right, not who is right. You're never aggressive, you're not passive even. You explain the perspectives, you tell them what is right, what is wrong, let them choose, but then gradually and subtly you drive them towards what is scientifically right. If handled appropriately, it can be also an opportunity for you to teach the family or guide the family or educate them as to what is right and what is wrong. You can change their belief even. So this is an assertive model. Coming down to it, you should always remember whatever strategy you choose, there is a 2 attempt rule. You try twice. If it fails, you try to escalate it to your senior person. Do not keep on hanging or lagging on the same thing again and again and again. There is a 2 attempt rule. Another thing is conservative response. It's a non-confrontational method, and it is used to ensure that disagreement does not escalate by seeking input and advice from other members. So is it okay, fine, I want to confront, but I don't want to be outwitted, or I'm confident in myself and it's going to take time and things. So the conservative or the response most people would prefer is, okay, neither me or you. Let's go to the third party and solve the issue. Whatever he says, we'll do that. That is also an act or a strategy for conflict resolution. There are particular scripts which are mentioned in team steps and a lot of quality programs where they teach in communication skills and conflict resolution. DESC is one of them. So what it is, DESC is D for describe the situation, E for express your concerns, S to suggest the other alternatives, and C, state the consequences. All this leading to consensus. I can give you an example of a DESC sample. To describe, when you don't understand or when you don't answer your return phone calls, there is a problem. Explain it. Why is it a problem? Because I'm worried that I won't be able to give safe care to the patient. If you don't answer, I will not be in a correct position to take advice from you at the right time. I feel unsafe. Suggest the alternatives. Okay, so I need you to respond, or somebody to call you, or give me another phone number, another person to reach out to, so that we can try this, right? And clarify that. If not, it is going to have an impact on the patient care. So this is a DESC script sample. You can have it with your colleagues. You can even have it with anybody at workplace or with patients. My preferential model is Lean. Lean is a very mature model of conflict resolution. You listen, you empathize, you explain, and you negotiate. It's very simple. Can you help me understand what you are upset for? What is the thing which is troubling you? Okay, this is understandable. I understand this now why you are upset. Then explain. Okay, so the reason why we want to do this surgery for this patient is because of so and so. Or we want to follow this management plan for this patient because of this and this. And then negotiate. Let's agree on a path forward. Whatever you decide, whatever I decide, this is the best thing to do. Lean is a model of conflict resolution. It always very successful. Now coming to the help and danger signs. There are certain times when you see, the signs and symptoms when you should not proceed ahead, when you should stop. If you see the person getting erratic behavior, pacing, hitting the ground, acting erratically, you need to stop and you need to involve a third person. Yeah. Your personal safety is the utmost important. So never be hostile. Use bad language. Show signs of irritation. Behave in an overly authoritative manner. Give an ultimatum to a person that you will not be able to follow through. No, no, we will do surgery or you take this patient out of the hospital. No, why should you take the patient out of the hospital? Do not be assertive to an extent which you cannot stand by, or which somebody else would come and resolve it. So better involve in the first place. Be safe. Be prepared for problems. Avoid any behavior which will make the people think that you are very rude or aggressive. So here are finally submitting some of the tips to handle, besides the strategies, whatever you want to employ to resolve the conflict. Listen to the complaint and identify the problem. The people when they come to the hospital, they're very vulnerable. They have complaints for every problem. Right from the time they entered, they couldn't find a parking. So they're angry. Why there is not enough parking? When the patient was shifted down, there was no wheelchair. They had to wait for 5 minutes to get the wheelchair. They know the patient is sick. When they got admitted, the patient was not shifted from emergency to the ward or to the OT for one hour. So there are a lot of problems. Identify, listen to them. Don't lose control. The patients are in pain. They are afraid. They are scared. They may lash out at every encounter. They have 10 encounters before they're seeing you. It's not a personal attack. It's about how they're feeling. So they are in pain. So first listen. Do not lose cool. And then remind the patient you expect to be treated with respect. Tell them, I'm giving you respect. I'm here to solve your problem. But please, gently calm down and tell me, and I'm here to help you. Empathize with the patient. I can understand why you're upset. There was no parking, or there was this delay, and this and that. And you may even say why you contributed to the situation. You can apologize. Even it doesn't harm. And then find a solution to that. So the relatives are feeling powerless in a situation, in a inappropriate behavior when they see this. Listen to their concern, empathize them, and then resolve. So these are the 5 points. If you follow this, it is going to help you a lot. 1 second. So listen to the complaint. Don't lose your cool. Remind the patient you expect respect for both. Empathize with the patient and find a solution. Always remember, whether you're dealing with a patient or a family member, it's important to acknowledge the other person's feeling. Take all the necessary steps to fully correct any problems. The patients and family members will remember your effort and your team dedicated to turning the situation around. They'll always remember you once they're out of the hospital, when they go back home. They'll always remember you, they will appreciate you, and some of them will give you bouquets of flowers or chocolates even. Thank you so much. I would like to acknowledge that the material collected in this presentation, which I have shared with you, has been taken from various sources, and especially National Academy of Medicine in conflict resolution setting. And I would like to acknowledge this. Thank you so much. Here there is a song to end this, as I always end up with a small snippet. I hope you'll like it. Thank you, everyone. I hope I was able to contribute something towards the understanding of what is conflict, and it was a gainful experience for me. Both I'm again sorry for starting late. There was a technical glitch, and I had to shift my come from the presentation room to another computer. This is a post-presentation survey feedback. I would very much appreciate if you can go on this link and then give a feedback to. This is also for your CPD points. It's important to submit your feedback to get the CME points. And that's it. Thank you.
Thank you. Dr. Manish. Yeah, it was very useful. It was very useful. Thanks, boss. Anyone has any question, he can ask Dr. Manish now.
You can speak or you can write down on the chat. Anybody? Good. So I think it was very easy and understanding, and everybody nobody has any questions. Everybody understood, right? How it is to go about, and then go ahead and take confrontation or being assertive in their behavior, or if not, involve the third party. Thank you so much. Thank you, everybody. Thank you for the educational committee and Dr. Basim to have arranged all this. Dr. Basim and Dr. Harman, yes, the educational committee team of the Hazrat Mubarak Hospital. And we look forward to many more interesting sessions with everybody. Thank you. Thank you so much.
Thank you, sir.
Bye.
Thank you, sir.